Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below.
I'm getting migraines several times a week,
Uh-huh.
and I'm getting bad symptoms from them, causing me to miss school and have a lot of stress.
So how long has been going on?
Since November.
Since November?
Yeah.
Okay, so now we are in January, so it's about like 4 months.
Mm-hmm.
Okay, so so what kind of symptoms do you get for migraine?
My neck and my shoulders will be really sore, and my face will hurt.
Uh-huh.
I'll get really tired.
Uh-huh.
I'll be sensitive to light.
Uh-huh.
It's not good.
So you said like a couple of times a week. Okay, so how much pain do you feel in your neck when you get migraine?
On a scale of 1 to 10, probably about 4 or 5.
4 or 5. Okay, so how much pain do you feel now and where?
I got a migraine today, and I have pain in my shoulders and my neck, and I've had that since I got the migraine this morning. And
you had the migraine medication, but you still have it. Okay, so you've been on medication since last November, you said. Okay. Any other treatment you had for migraine?
What?
Any other treatment you had for migraine?
No.
Yeah. So any symptoms? You said you get nauseous or dizzy, light sensitive.
Yes.
Okay. Do you get aura?
Sometimes.
Sometimes. Do you have aura today?
No.
Okay. Do you feel pressure behind your eyes today?
Yes.
Okay. So any other symptoms?
Not that I can think of, no.
Okay. All right. So everything should not aggravate your symptoms. So let me know if you feel any pain, okay? So do you think it starts here or starts in the front?
The migraine?
Yeah.
Sometimes it starts by Q, and sometimes it starts in the front.
In the front. Okay. And you said you're taking medication, and do you get side effects from the medication?
Yes.
Okay, what side effects?
All the shoulder pain and chest pain.
From the medication?
Yes.
Yes, okay. You said you get jaw pain too?
Yes.
Okay. Is it painful or something?
No, it's okay.
You feel that scar tissue here? This bump, it's actually scar tissue. Is that painful or okay?
Okay.
You see your range of motion turning left and right. Okay, it's not bad. Okay, it's a little bit tight backward. Okay. Any pain with any of those range of motion? Okay. Okay, let's see. You feel the tightness here?
Yes.
Okay, make sure this is not painful. Okay. Did you have any trauma or accidents or fall?
No.
Sports injury in your head?
No.
Let me hold you. It's the pressure behind your eyes. So it's a difference.
No.
That's also scratch. Maybe it's too much. So what grade you're in?
Sophomore year.
It's too much. Are you wearing contact or?
No.
Sorry. I'll check this out. Lift your head up. You said it's around this area. This is the area you usually feel the most of the tightness here?
Yeah.
Sorry. Is that painful? Sorry.
Yes.
Sorry.
Yeah.
Sorry. You get a lot of tightness. You feel that tightness here? Think something you like, okay? Do you like chocolate or ice cream?
I like both.
Both. I had a patient ask, like, do you like chocolate or ice cream? She said, of course I like chocolate. So I asked her, like, what type of chocolate? She said ice cream, sorry. So I said, like, what kind of ice cream? She said, like, chocolate ice cream. So I think it's both.
That hurts.
Sorry. So think about you eating your chocolate ice cream, but don't eat it. But you eat it in your mind, okay? Chocolate is good. If it's dark chocolate, ice cream is not good. Okay. Is it too much?
No.
Okay. You clench your teeth at night?
No.
Not grinding or anything?
No, not that I know of.
Did you have any accident, like motor vehicle accident?
No.
Shrug your shoulders toward me. Shrug. Yes. Okay, let's set up for me. How you feel? You still feel?
Yeah, not as bad.
0 to 10.
3.
3, where do you feel it? You can turn around. Your eyes is more open now.
Yeah, that helped.
Yeah, can you feel that?
Yeah.
Okay. So where do you feel the 3?
Probably like back here.
In this area.
Yeah, in my shoulder. So.
But behind your eyes, the pressure is gone.
Yes.
Or you still feel it? Yeah.
Yes.
Okay, so you feel it here and on the other side too. Okay. So okay. Is it here?
Yeah.
You feel that?
Yeah.
You feel that bump here?
Yeah.
Okay. Make sure what I'm doing is not painful, okay? You can put your reward on the side. We'll get to that. Okay, sit up nice and tall. This painful? What I'm doing here?
Yes.
Sorry. That painful or is it?
Yeah.
This painful?
Yes.
What about now? Painful?
Yeah.
What about now?
Yeah.
Okay. What about here?
Yes.
So everything is painful here when I touch. Okay. Shrug your shoulders. Shrug. And relax. Okay. Shrug your shoulders. And relax. You get a lot of scar tissue. Are you comfortable? Is it painful here?
Not as much.
So it starts to relax now. Is it painful? It's okay.
Painful.
What about now?
It's okay.
Still painful? You got a lot of scar tissue, especially here, those 2 knots. So, so even you have the migraine medication, but you still have symptoms, yeah?
Yeah.
Okay. So you missed the school today?
I was there for like a couple hours and then I left.
And you left because the symptoms was really severe.
Yeah.
You feel that here?
Mm-hmm.
Okay. You can actually see the redness. That's where the scar tissue. She has a big scar tissue here. Can you see this? You see that here in this area? That's a scar tissue. So it should disappear in 10 minutes after the treatment. What I'm doing is really very gentle. Any pain here?
No.
It's okay. Right in here. She has a scar tissue. And right in here too. Okay, so let's move your neck and tell me how that feels.
Better.
You still have symptoms or it's gone?
Pretty much gone.
Yeah, awesome. So look in the camera and tell me what do you think about the ASTR treatment?
It's pretty good. I feel a lot better than I did
Yeah,
before.
just good, awesome. Thank you so much.
Yeah, thank you.
No symptoms? Beautiful, awesome. Thank you. All right, Carrie. So tell me, the first time I saw you for migraine, it was like about a year or something like that, a year and a half.
I think so. The last time I saw you the first time I saw you for migraines was, I think, January 2018.
Okay, and now we are in 2019, October. No, September. So, can you give me a brief history, like what you were experiencing before I saw you, how long that would been going on?
I was getting chronic migraines, and it would affect like my vision. It would give me neck and head pain.
How long this was going on before I saw you?
It was going on for a few months.
A few months. What kind of treatment you had before ASTR treatment?
I would just take the medication.
Yes. Okay. Did you have like any physical therapy, chiropractic,
no.
acupuncture? All right. So when you received ASTR treatment, how many treatment you had, and you start to notice difference?
After one, I definitely felt a difference. Yeah.
So after that, how many total sessions you had, and you will feel like back to normal?
Yes.
The first session?
Yeah, after the first one, I've started to feel better, and each one helped.
So, the last treatment that I saw you, like last year, probably March or February, March, have you had any issues or everything was fine?
Not really. I've had a lot less, maybe a few times a year, which is definitely better than a few times a week.
So it was more frequently.
Yeah.
That's nice. Yeah. So what do you think about ASTR treatment?
It works really well.
You can treat your pain at home and get similar results as what you just seen in this video. Simply click the link on the screen to start our home treatment program and begin your journey of healing, or go to astrinstitute.com.